During a press conference on Thursday, the Minister of Water Resources and Sanitation, Joseph Terlumum, raised the concern. According to him, a total number of 63 deaths and 2,102 suspected cases have already been recorded as of Wednesday, July 3, since the outbreak of the epidemic. The minister has called on government across board to set up efforts to clean drainage after recent non-stop rains caused flooding in few states and the Federal Capital Territory, FCT. Joining us on the news is Dr. Matthew Okoh, a public health practitioner. Dr. Okoh, thank you for joining us.
Thank you, Felicity. It's always a pleasure to be here.
How does increased rainfall and flooding typically contribute to the spread of cholera outbreak?
With increased rainfall and flooding, the risk that arises that the flood water typically sometimes will overflow sewage systems, especially in places where we do not have sewage system with good integrity. And this overflowing of sewage system can sometimes carry along with it human waste, which we know. We know that cholera is a fecal-oral infection, which people excrete the bacteria from through their stool, and when water mixes with sewage and carries it along, it will contaminate the water that people drink, and then it can further lead to spread of the disease. In addition, temperature and humidity that is often associated with rainfall will also encourage the growth and spread of the bacteria, and then increasing the chances that people may get infected.
This is something that seems to come up every now and then. Could you maybe elaborate for us specific challenges that is faced in trying to control cholera outbreak, especially during flooding season in densely populated urban areas?
Also, as you have mentioned, in terms of densely populated area, cholera is basically a disease of hygiene related. Because when people use the toilet and they do not wash up after themselves properly, they can spread this, carry this bacteria along with them and spread to other people. People we still practice open defecation, right, in this country, creating the opportunity for flood water and to carry the human waste along with it, and contamination of drinking water that who have, particularly in places where people do not have secured or safe drinking water. So this is a big challenge where we do not practice hygiene, washing of your hand for at least 20 seconds with soap under running water, properly treating your water that you drink. If your water is not safe, you can make it safe by boiling it. You can use chlorine-based disinfectants to disinfect the water and make it a little more safe for you. But by and large, hygiene is the primary factor that we have here. And then people who live in crowded areas tend to have problems with sanitation, and then predisposes them to the risk of becoming infected.
Dr. Okoh, thank you for speaking with us.
Thank you.